Hello, my name is Mikayla Buford, and I'll be presenting on our paper, Crisis Couture, a study on motivations and practices of mask makers during a crisis. The landscape of everyday fashion has been transformed due to the COVID-19 pandemic. Part of this can be attributed to the different types of communities, fashion makers, sewing, who have designed and fabricated masks to counter global shortages and negative culture backlashes. In this paper, we present a mixed method study of individuals and groups within these communities on their motivations and practices in designing and creating face masks during a global crisis. We unpack themes around technology, self-expression and statement making, making and remixing, sustainable practices, as well as the role of design inspirations on methods and practices for mask makers during a crisis. We initially interviewed 3 self-described designers about their experience creating masks for a local hospital, and found that the context of their response and the lack of information they described about materials and testing greatly affected their designs. To further understand the challenge and motivations for individuals who are making face masks, we conducted a formative survey with 66 participants, asking them about their experience making face masks. We allowed the respondents to share images of face masks that they have made, as well as ask things that inspired their designs, their background experience, and motivations. From this pool of respondents, we chose 23 participants to interview and investigate further on their motivations for becoming a face mask maker and the challenges they have faced. Although our survey was available worldwide, most of the respondents we spoke to were from North America, with most living in areas mandating mask wearing at the time of the survey, which ran from May to September 2020. Interestingly, we found that most mask makers were using designs of their own and others. In talking with some survey respondents through our interviews, we found that makers would use their designs from online communities that they were part of, those shared on social media platforms, or resources from organizations like the Centers for Disease Control and Prevention. Several themes emerged from the interviews around the practices and motivations of mask makers. There was a strong link between the influence of technology on everything from the source of the mask design to the coordination of mask making and even facilitating Black Lives Matter protests through masks. I'll first talk about mask maker practices. Technology served a different role for certain makers. Some makers would use it as a source for inspiration or patterns. Other designers use design software or digital fabrication machines like laser cutters or 3D printers in their design process. Mask makers participated in offline and online making by actively contributing to online Facebook groups or providing open source patterns and instructions for creating face masks, as well as sourcing their designs from internet sources like YouTube. We found that online makers used more online resources to research safety and testing measures for mask making. Other mask makers who created and evolved their designs on their own, the offline makers, said that they transitioned to utilizing online resources and platforms later, which changed their design process for some. An example of this can be heard from one of our interviews.
The actual construction, because I had enough communities to go into. If I had a question or I ran into a problem, I could just pop in and say, oh, hey, how do I deal with this issue? And someone had an answer.
Yeah. Another practice was making and remixing. Some mask makers worked from original designs from the start, while others redesigned or remixed existing patterns. Some makers used or posted open source designs for remixing, and all the makers used a participatory design approach with those that they made masks for, such that they iterated on their own designs based on the preferences and feedback of those that they made masks for. Iteration was also triggered by new information about mask safety, material shortages, and striving to use more accessible mask designs. Another practice was sustainability. Due to the shortage of and lack of accessibility to certain materials, many mask makers reused existing materials to make their masks or made sure that they were washable for reuse. In the leftmost picture, one mask maker used shoelaces instead of elastic bands on their mask. In the middle picture, one maker used organic dyes to customize the masks they made. And in the last picture to the right, one maker transformed reusable bags from their local grocery store to create masks. So I'll talk about the mask maker motivations. There were 4 themes. The first was social good. A significant motivation for mask makers was making a face mask so that they would be worn. This led participants to make and donate to vulnerable communities, design masks for those with disabilities, or make masks specifically for children going back to school. Another motivation was answering the call or not. Some participants said that they started making face masks because someone they knew asked if they could start making masks for them. Conversely, some participants began in need of income or to supply demand as a business. The third motivation is statement making. Participants indicated that they were motivated to make face masks with greater self-expression that reflected their identity, heritage, or interests. The last theme is crisis community. Some participants partnered with their city to make face masks, joined online groups, or created their own local groups to make and donate face masks.
The tangible and relatable message that goes with it is also community. Because, in a sense, I told you, I started this where I just wanted it to be over because I had things that I needed. And, you know, the world was in a pandemic. I was very vain and selfish. However, I found a community where essentially they were in the same boat, and knowing that I wasn't alone and knowing that it wasn't just me feeling this way, my thought process kind of changed. It wasn't just flatten the curve so we can do this. It's, all right, let's make an example of New York. Let's not only flatten the curve, but show we can be together as a community and as a unit.
A common challenge that mask makers brought up in their interviews was scaling their design for continuing demand. There's significant potential in crisis situations to provide technology interventions for areas such as scalable manufacturing processes, information management for sourcing materials, and possibly scientific data to support these makers. The stories of motivations, challenges, and inspirations shared by the makers exemplified how storytelling could engage others to participate in making masks, wearing masks, and advocating for causes like accessible design and the Black Lives Matter movement. Although there were communities for makers to organize and design with, they mostly worked in isolation and asynchronously. There were many value tensions that they had to deal with, like donation versus monetary opportunity, that caused designers to make difficult decisions. Similarly, designers weren't able to effectively evaluate the safety of their designs, but did so upon reflection long afterwards. Considering how to build systems to better support collaboration in crisis for a non-technical audience is needed. Our findings led us to 4 future considerations. First, individuals can go beyond the title of maker during a crisis. Whether an individual is part of a particular community before a crisis, they can take on a whole different identity due to the urgency to respond. How can we better study this fluidity or identity and roles when designing during crisis? Second, every face mask maker had a story. How could these stories be spread and shared through design systems to make them more widespread? Third, the perspective of the mask makers is critical given their contribution to civilian health and compliance. However, the lack of verified information or a formal procedure for making made the process difficult for mask makers. Further research can be done to understand the limitations to the response of makers during a crisis. Lastly, some of the mask makers we interviewed and surveyed didn't consider themselves designers or makers despite participating in similar activities and practices. How can we engage these individuals who reside outside of the online communities for designers and makers? Thank you so much for listening to our presentation. You can read more about our paper here.